The Foot and Ankle Ability Measure, or FAAM, is a self-questionnaire outcome measure that assesses physical function for individuals with foot and ankle-related problems. This test targets people with musculoskeletal conditions and brain injuries. This test is 29 items, and it is divided into 2 subscales. ADLs, which has 21 questions, and this subscale asks questions about the individual's ability to stand, walk on different types of surfaces, go upstairs, and many other daily activities. And the sports ADL subscale is composed of 8 questions, and it asks about the individual's ability to run, jump, land, and other types of sport movements. These questions should be answered based off the patient's condition within the past week. So some special considerations: the patient may need assistance reading or comprehending the questionnaire. This information is very subjective, so we are relying on the patient and how they answer the question, and the patient may not recall what their activities were during the week, so they may need some assistance if they have someone living with them or a caregiver. This test takes less than 10 minutes to perform. There's no requirements, and all you need is a pencil and the questionnaire. To score the Foot and Ankle Ability Measure, we take the responses described by the patient's conditions within the past week, and we gather these, and the outcome is determined by a 5-point Likert scale. So the patient answers their questions based off this scale, with 4 being no difficulty performing the task, 3 being slight difficulty, 2 is moderate, 1 is extreme, and 0 is if they're unable to do the task. So once we get these scores added up, we separate them into 2 scores, 1 for each subscale, add the score, and divide by the total possible points, and multiply by 100 to get the percentage. So a higher percentage represents a higher level of function.
Our next test is the lower quarter Y balance test. You might use this test if maybe you're working with someone who just started a new activity and you want to determine what their risk for injury is. Or you might use it if you're trying to determine if someone is ready to return to sport or not. This test is not performed on a specific age group or population. The target population kind of goes back to what I said previously, in that you may use it if you are working with someone and you want to determine their risk for injury or if they are ready to return to sport. So now I'm just going to give you a brief description of the test, and then in the next few slides we'll get a little more specific and tell you exactly how the test is performed and how it's scored. So if you're the person that's administering the test, you will ask the person you're working with to stand on one leg. Whichever leg they're standing on is the leg that will be tested. You will then ask them to reach in 3 directions with their non-stance leg, the leg that is in the air. You will ask them to reach in the anterior direction, the posterior and medial direction, and the posterior lateral direction. In order to get an accurate score, 3 trials are performed. If you are administering this test and you notice the person you're working with is placing their foot on the ground that is supposed to be in the air, then you should not count that trial, because they are compensating by shifting weight to the other foot in order to maintain balance with more ease. This patient may also compensate by putting all of their weight through their stance foot. This may be a hard compensation for the person who's administering the test to catch, so it is important to remind them throughout the test to distribute weight evenly in both legs. This test should only be performed on someone who has adequate balance and should not be performed on someone who is at high risk for falls, because you could be putting that person in danger, and we would like to avoid that at all costs. This test may not be the right choice for elderly patients due to balance deficits, which, as I stated before, the benefits would not outweigh the risks.
On this slide, we are going to be talking about how is the lower quarter Y balance test performed and scored. Before the test is given, you will need to make sure that you have the Y balance testing kit and that the person administering the test has completed the training course necessary. After you have done those two things, you may proceed to begin the test. To begin, you will have the patient take off their shoes. Next, you will have the patient place their foot of the limb being tested onto the center of the foot plate with their toes just behind the starting line. While maintaining a single leg stance, have the patient extend their free leg as far as they can in the anterior, posterior medial, posterior lateral directions. Patient is encouraged not to touch the tape, just to hover over it. Measure the max reach for each leg in each direction by reading the distance at the edge of the reach indicator closest to the subject to the nearest half centimeter. This test will be performed on both legs in this specific order: right leg anterior, left leg anterior, right leg posterior medial, left leg posterior medial, right leg posterior lateral, left leg posterior lateral. Once both sides have been tested, a composite score is calculated by taking the sum of 3 reach directions divided by 3 times the limb length, then multiplied by 100. The max reach length of each direction is used for comparison to normative data. If there is more than 4 centimeters difference compared to the uninvolved leg, then the person has a higher risk of injury. Overall, this test will take about 10 to 15 minutes to administer.
Okay, today we're doing the lower quarter Y balance test, and I have Taylor, my patient, here. So this is going to be testing your balance, and I'm going to show you how I want you to do it. So you can start with your left or right, whichever one you want to do. Just put your foot like this, and while keeping your balance, I want you to reach as far as you can and just quickly tap and come back, okay? Mm-hmm. Same with this side, just tap. Same with this side, just tap. Okay? We're going to go around 3 times to do that. So do 1, 2, 3, 1, 2, 3, 1, 2, 3. I'm going to mark each time.
Okay. You want to go?
Yeah, so go ahead and put the ball of your foot on there. You're starting with your left foot. Mm-hmm. Scoot your foot back just a little bit more, just like that. I want you to go as far as you can and just tap. So right here, if the patient had not returned to their starting position under control before during their next reach, or they touched down during each reach, it would have been a faulty trial. Now, come around here. Okay, gotcha. Now come back right here, as far as you can. All right, that was all the first trial. Alright, do it again. Okay. Back around. Alright. One more trial. Alright. Alright, now I want you to swap to your right leg, mm-hmm. and do the same thing for me. Right here, that's right leg 1. Right leg 1. Okay. Go back through that rotation now. Okay, right leg 2. Can you do that one more time for me? One safety concern that you want to be cautious for is the patient could lose their balance and may be at risk for falls. 2, one more. 2, Do that one more time for me. Make sure you keep your balance, okay? All right, let's go through them one more time. Can you do that for me one more time? All right, since the first two trials you went there to there to there first, I want you to do that again.
Oh, yeah.
So let's just start that trial. Let me X out the one you did. All right, I'll start by going this way. Okay, it's right leg 3. I'll go right here. Okay, the last one right here. All right, great. Okay. So here's the scoring and the interpretation of the scoring. As you can see, we have our right and left leg and our 3 directions. Direction 1 was in the anterior direction, direction 2, posterior medial, direction 3, and posterior lateral. And what we did was we took the 3 measurements from in each direction and got an average, and that's why we divided that by 3 right there. So for example, I'll just use the first one, direction 1 in the anterior direction on the right leg. The patient had a reach of 65 centimeters, 65.7 centimeters, and 67.2 centimeters. So if we had divided that by 3, we would get the average. Once you get the average in all 3 directions for the right and left leg, you'll see at the bottom that you will take the average distance in each direction, divide it by the patient's leg length, and times that by 100 to get a composite score. So for the interpretation of this scoring, a max reach length of each direction is used for comparison to normal data. You do not want a difference greater than 4 centimeters on the left and right reach, because of asymmetries of this magnitude may be significant when you consider their injury risk and return to sport. The composite score should not be less than the cutoff point specific for the patient's age, gender, and the sport or activity that they're involved in.